Hello, everyone. Today we're starting a cycle of our, well, let's say short messages that will be dedicated to such a phenomenon as herpes, but also in parallel to other viruses that can be called domestic. All viruses in our body are divided into two major groups. These are guest viruses that come and go. Well, at least that's what medicine believes, and domestic ones that take root. They start living in our body, partially determining our diseases first and foremost. Among the known and most well-known domestic viruses, we have identified herpes. It's divided into 8 types, problematically treated from the perspective of modernized medicine approaches. Individual viruses, they also belong, let's say, papillomavirus, over 200 species. And there's also therapy against them, 15 of which are considered pathogens. They have different reproduction cycles, and they're also very difficult to remove from the body, since they also cause cancer diseases, especially in synergism with herpes virus, as recent research has shown. Well, and those viruses that we already know well, this is immunodeficiency virus, or HIV, this is viral hepatitis, and so on. And including those viruses that are bacteriophages, about which we have virtually no understanding. Well, for example, there's such a concept, well, as advanced in medicine as the human body's viral. True, no one studies it, and you won't find tests anywhere. But there are certain viruses that parasitize in our intestines on bacteria and create a certain role in the system of so-called intestinal probiotics in the system of microorganisms, fungi, viruses that inhabit our intestines. And as it turned out, there are very, very many of them. And in order to start this presentation more clearly, we will talk about alternative ways of healing and cleansing from herpes. I asked our respected Orika to ask me questions because I'll try with the help of her questions to make the narrative more understandable from the perspective of some simple variants, so you understand what we're generally going to talk about. Go ahead, Orika, ask a question. Leonid Valerievich, is it true that viruses communicate with each other? And why do they do this? Yes, but I would formulate it a bit differently. The fact is that we people are divided into so-called two main positions. Position here is still a worldview, and some of our people adhere to materialistic theory. But if we take atheists, they are generally, you could say, such ardent materialists. Since in this case they don't even understand who actually created this world. They simply say the world is material because it's material, and that's it. And part of the people, there are also many of them, are divided into so-called conditioned idealists, or this is called vibrational theory of space origin, or space as illusion. Well, if you tell, let's say, a teenager, what would you choose, material world or vibration? The teenager will say that, of course, material world, I can touch myself. But if you say that Elon Musk said that only 1/1000% is the probability that the world is material, he'll say, of course, I choose illusion. And here, since Elon Musk is an authority for him, and he respects him, but not everyone understands how shifted the system of views on materialism and idealism is now in scientific circles. And here the attitude toward viruses is very important, because if consider a virus as a material quantity, as protein threads, then the classical scientific approach says that this protein can't do anything big in our body from the perspective of some collective action. And our narrative will be precisely about collective action of viruses, and hence their so-called numerous manifestations. Because as many disease manifestations as herpes causes, no other virus has. It's not even capable of inventing, you could say, so much pathology. And here we're talking precisely about allowing that viruses have an upper management level. But just like an anthill has an upper management level, each ant has its function, assigned value. It knows where to run, what to do. In this case, we're talking about organizing the virus function as a protein. And it turns out that science has already proven that viruses, when attacking, let's say, bacteria, include the human body, they form so-called numerous signaling peptides, which they call arbitrium. And these arbitriums, or signaling peptides for communication of the virus that's in the cell with viruses in other cells, They use them to not completely destroy, let's say, that biological platform on which they conduct their reproduction. Conditionally speaking, a colony of cells or organism on which they multiply. Although this also often happens. Accordingly, it turns out that with these proteins, they signal even where to approach, in which direction to move the virus, although this sounds strange. And accordingly, they signal that activity needs to be increased, that there's a so-called convenient moment for this. And more than 100 such peptides have already been found, and accordingly, such a science has emerged. It's starting to develop. This is sociovirology. You probably haven't heard about it, but it exists. And there are more and more articles about the so-called social behavior of viruses in relation to our body. Now, what conclusion can we draw? That viruses have an upper management level. It's definitely intelligent, but from the perspective of our concepts, it has a certain behavioral program, and therefore it can perform a function, which in this case is not entirely comprehensible to us as human consciousness. Because for us, the virus that resides within us, particularly herpes, it hides in axons, in nerve tissue, remains there in a passive state until certain immune changes occur. As soon as a signal passes through nerve tissue and immunity fails, it begins to manifest. That's where knowledge ends. But what can do much more, so-called more complex things, is very difficult to understand, especially from a medical standpoint. Next question. So it turns out the viruses have some common goals even? Yes, and moreover, they can unite, and furthermore, they can group together in their manifestation. We will attach articles to this message. They are scientific though, because we don't have such, well, except for the Zen channel. This is quite rare information that viruses have internal exchange systems. For instance, there are numerous studies by both Chinese and American scientists on the synergism of genital herpes virus, including herpes simplex virus, with human papillomavirus. This is HPV, abbreviated human papillomavirus. And with HPV, they combine and begin creating quite persistent pathological conditions in the intestines. Well, then comes malignancy, the emergence of cancer cells, and eventually what develops into disease. Therefore, synergistic processes are also described, but they are described again from an observational standpoint. We see that yes, here is this virus, this results in such a phenomenon, but this is not described as social behavior, as a large systemic process. So even different types of viruses can communicate with each other, it seems. Yes. And where is the herpes virus located in the human body? This is a well-known fact. It's either in axons, that is, these are like, you could say, little wires in the skin that penetrate and form our tactile sensitivity, cold sensitivity, and so on. And these include spinal ganglia. And hence the manifestations that, again, medicine previously didn't associate with herpes. For example, now more and more studies are leaning toward the idea that, say, severe headaches or intervertebral disc protrusion or infertility. This is herpes virus. We will talk about this. And this migraine is a classic manifestation of herpes, which, by the way, is treated with ordinary purine nucleosides. These are cyclovir, versiclovir, but these medications that are currently the only officially recognized medical treatment for such conditions. And how does the herpes virus affect immune status? And can you reveal what specific diseases it causes? This is the most interesting question. But this is my personal observation, because we don't have that many herpes specialists in Russia. Moreover, I previously reported that we had, say, in 2010 to 2005, many herpes centers in the country. And people would come there and they were specialists. They even had the title herpetologists. For example, if you even ask old doctors now, they probably won't remember that there was such a specialty as scabiologist. A scabiologist is a specialist in scabies, and scabies is a skin condition. There's no scabies, no scabiologist, but accordingly, there's no such specialty either. And here it's somehow strange that it contradicts the trends that are happening now. We now have a trend that herpes is manifesting more widely, more densely, and participates in disease more and more. Yet herpetologists have practically disappeared like vanished. And practically all herpes centers in the country have closed. One remains in Moscow. It only kept the name, although they just preserved the name, though they also have specialists, of course. But for example, in Novosibirsk, there were 4 herpes centers, not one remains. This doesn't mean there's less herpes, it means processes have gone in some other very difficult to explain direction. And according to the scenario, these clinics were removed from our so-called understood space. Tell us about your developments of antiviral drugs and restriction enzymes. There is a classical understanding, particularly among virologists, immunologists, people who deal with immune status, that restriction enzymes are the first barrier to infection penetrating the organism. And what is infection? Particularly, we're talking about viruses, not bacteria. These are foreign proteins. They detect them, and these enzymes begin cutting them. And particularly the viruses themselves that try to penetrate the cell, they consist of capsids, will attach a little drawing. Moreover, these capsids have different configurations. Viruses of different sizes, double-stranded RNA, single-stranded. They begin removing the shell at this moment. The enzyme approaches and life. Scissors begins cutting their chain, making their reproduction impossible. And it also penetrates the cell together with them, since these enzymes, restriction enzymes, they are not foreign to the organism. They are natural proteins that accompany our functionality in general. And the fact that our body has many enzymes, science knows about this, but for some reason this direction was on. Developed in our Scientific Production Association vector back in the 80s, I think more in the 90s. And it was developed as one of the defense mechanisms against the possibility of biological warfare, that is, the breakdown of viruses. And then it transitioned into various developments, not only in Russia, but there are such patents worldwide. But a product that is accessible to humans, strangely enough, had not been developed. And this strangeness is also very difficult to explain what it's connected to, because our medicine is mainly oriented towards Rothschild and Carnegie medicine. You can search for this on the internet. We can also attach a video. At the end of the 19th and beginning of the 20th century, medical schools taught many subjects. There were homeopathic medical schools, naturopathic schools, herbalist schools. That is, there were many diverse approaches to treating diseases. However, the Rockefeller and Carnegie foundations were interested in establishing one single universally recognized approach. But how did they achieve this? They took control of the entire education system and created a medical monopoly, essentially eliminating any competition. These are synthetic chemical compounds like aspirin, analgin, including these purine nucleosides, which accordingly interact quite effectively with the body's symptoms. But they have one characteristic: they don't cure the disease. They help the disease process by reducing symptoms as a rule, except for antibiotics, of course. And it turns out that this path from so-called enzymes, which were studied on various animals, interactions with various pathological viral diseases, it was quickly traversed during COVID times, when I already understood that. There was no other way out but to make something quick and effective. Naturally, if we had gone the route of registering a medical drug, we would have gotten stuck for many years. That's 5 to 10 years. And it's still unclear whether we would have created it or not. Because it's still a protein, the enzyme itself is extracted from bacteria. It's quite difficult to certify from a classical pharmacy standpoint to purify, although we've already done this now. And accordingly, we made a dietary supplement called Batrodolay, which contains these restriction enzymes. Protease is in first place there, and additional proteins are listed. This is a bit of Endonocles RNAs. They're sufficient in very small doses to fill the body with such a degree of protection that herpes manifestation itself passes within several hours. This is especially important for diseases like intestinal virus. When a person is vomiting and can't take anything, you can only give them a suppository. And accordingly, in this case, it is all Betrodolai, and ours is oral, called an orally destructive tablet, if we're speaking medically. Because if you swallow this tablet, the enzyme getting into the stomach, the acid simply breaks it down and it doesn't carry this functionality. The enzyme itself looks like a jellyfish. Inside it is an activator, which is magnesium. And it acts like a battery activating these terminal endings, which perform hydrolysis of nucleotide chains. Now, I'm starting to speak complicated, it's already incomprehensible. But one way or another, this needs to be understood. In this case, we're talking about cutting virus chains, the virus chain itself, which becomes unsuitable for reproduction. This is how, by the way, quite long-lasting effects are achieved, effectiveness for some reason. Why we haven't studied yet, but we're already noting elimination processes. That is, removal of herpes virus from the body. And we're actively studying this process, and we'll continue publishing scientific articles. And possibly someday we'll get to a medical drug if that works out. Although there's no such specific goal yet. How does the rhodolite supplement affect HPV and COVID-19? For papillomaviruses, we only have, let's say, positive and negative observations. That is, in some people, these so-called growths on the neck, arms, under the armpits, they fall off. Well, that means we hit the reproduction cycle, so to speak, and in some people they remain. Therefore, we can now say that Rhodolite effectively helps with papillomavirus unless it's in an active stage. If activity is confirmed, if PCR is positive, it will definitely work and work effectively. But everyone knows that phenomena like warts and so on last a very long time, so you might simply miss the cycle. If we talk about the influence of herpes virus on immunity, the herpes virus begins to model and force lymphocytes and monocompetent cells penetrating into their structure cell nuclei. It begins to produce so-called false proteins, false interleukins, false interferons, which begin to interact with the entire body. Leading it to such systemic diseases as Alzheimer's disease, multiple sclerosis, rheumatoid arthritis, and this is now proven as well. We'll talk about this separately because everything there is so fascinating. When I was reading all these scientific studies, there were very high percentages of herpes involvement. For example, they accidentally discovered connection between herpes and type 2 diabetes. The Americans, because they suddenly started doing histological studies, took PCR tests for herpes type 2, which is genital herpes in patients with diabetes. Then they started digging deeper and found that practically all people have herpes type 6 in a fairly active phase. Then they dug even further and discovered that with age, herpes starts adding subtypes and subclasses to itself. This means that first a person has levial herpes or simple herpes type 1, then genital herpes. Then, unless they have herpes zoster shingles, God forbid, other types join in. Then herpes virus type 4 joins in, which is the Epstein-Barr virus. It's present in practically all elderly people. And then it's a matter of luck. There's type 7 virus, which causes chronic fatigue syndrome, when a person walks around constantly unable to lift their head, constantly tired. And type 8 is Kaposi's sarcoma, which is already an oncovirus. And so on. Well, type 6 is this mysterious virus. We'll definitely dedicate a separate broadcast to explain its so-called mafia role. This is where the social role of the virus begins, because herpes virus type 6 is now recognized by many scientists as a virus that's like a godfather, residing mainly in lymph nodes. And it controls the system of viral interaction in the body with organs, the lungs, heart, pancreas, liver. If we look at diseases in general, it's very hard to name a disease today where herpes virus isn't involved somehow on the side right, left, or as the foundation. And this is important to understand. This is where rethinking begins, that herpes virus, by altering immunity, creates so-called false cytokines. Cytokines are immunocompetent proteins. It starts creating, literally modeling, various pathological disorders in the body that lead to systemic diseases, which are partial Leninist medicine targets, or that Rothschild Carnegie medicine that starts pushing whatever's on the market. That is chemotherapy pills that are supposed to drain a person's budget into the negative and add it to where these pills come from. This is business now. So all this treatment is connected more to the fact that pharmacology dictates to doctors what to treat, how to treat, when to treat, who to treat, and so on. And Trump's recent statement about acetaminophen caused such an uproar in pharmacy, since everyone knows, though it's not widely known, that acetaminophen causes 86% of poisoning from all medications combined, 86%. Well, maybe I'm off by a few percent. But few people know that it also creates complications in people, especially elderly, that are practically impossible to deal with. But it's actively sold, and pharmaceutically it's the #1 substance in the world by production volume and sales volume. And this pure poison, which does nothing for a person, absolutely nothing, doesn't create anything except lowering pain thresholds. Yet medicine promotes it as an option even for children. I won't go further, this isn't an interesting topic. From the standpoint of using natural substances, our science is really lagging behind. Yes, we've recently seen immunobiological drugs appear, and they're gradually starting to occupy their niche. But this process still lags far behind this classical, I'd say, crude medicine. That's more oriented toward the profits of pharmaceutical manufacturers. If we do another broadcast, though they exist online, about the cyclical nature of pharmaceutical drugs, we'll notice that every 20 years, drugs were used well and ceremoniously are forgotten. New ones come along, and the old ones start being recognized as useless, non-working, bad, and so on. They start being massively erased. Actually, it's simple. Most drugs become generics. Generics start being produced by Chinese Indians and so on. They become uninteresting in the market, and pharmacy starts inventing new substances that are still poorly researched, and so on. And this starts reproducing over time. Is herpes virus always detected in tests, or might a person not know about it? No, not always. The problem is that when we do a PCR blood test, this is rare, only during flare-ups. Mainly reliable data is taken from places of active residence, say from mucous membranes of sexual organs, from saliva. Not to mention spinal fluid, if it's active, say with migraines, it's 100% there. So it turns out that actually detecting a virus is a very rare occurrence. Here you need to understand that it certainly leaves traces and it can be detected. But it's enough to detect even one type of virus. Herpes, understanding that it has partners in the body. Few people know that there exists something called an isolate. Let's say if a person takes a cyclover or valacyclover, these are purine nucleosides. They really do block the reproduction of the herpes virus in the cell. And there's nothing to argue about here. And they really do help. How do I know this information? This is research on the effect of purine nucleosides on migraines. The migraines start to disappear, and a connection emerges. We prove the connection, although it's extremely difficult to determine in the laboratory. No one will just take spinal fluid like that for testing. And it turns out we have so-called precedents, but we also have knowledge that when taking purine nucleosides, so-called isolates emerge. An isolate is a virus that has deviated from its own program, modified itself, and this purine nucleoside no longer affects it. It starts to mutate within itself. This is a property of viruses, it's proven. This is part of social intelligence, by the way. And so it continues to live in the body, but these purine nucleosides no longer work on it. And naturally, there are no such observations that elimination occurred. There are observations about enzymes, but they still need to be proven. Established, brought into compliance, that's not a one-year process. And it turns out that these isolates are practically undetectable by PCR diagnostics. Therefore, it's necessary to understand the diagnosis of herpes virus by other science causes, causal relationships, and most importantly, by the manifestation of their relatives. Because the virus operates together, so to speak. Type 1 virus, these are kissing viruses. Can you explain in simpler terms how herpes reacts to Bacteroidelia? That is, if a person starts taking bath, does an outbreak occur? Or does it gradually subside, or how does this happen? Well, here it's a question of virus concentration in the blood. The herpes virus itself has two types, so to speak. Mainly it goes and prefers to go from cell to cell. So the research we did at the Influenza Institute in St. Petersburg showed that, for example, the effect of bad rhodolia on cell culture infected with coronavirus intestinal, not COVID, they have conditionally 47 units of effectiveness. And on type 2 herpes, it has an effectiveness of 17 units of activity, well in relation to the baseline of 0. Accordingly, what conclusion do we get? 17 is practically 3 times less. It's less active against the virus, less active. That is, in terms of activity, herpes itself resists 3 times more compared to coronavirus. But it turns out we need to increase the dosage. We already prescribed 2 tablets to dissolve 2 times a day during exacerbation. This is for people with normal weight. And if the weight is higher, then even 6 tablets. You need to take this for at least a week, then real results start to show. At the same time, Bacteroidelia itself can cause an exacerbation of another type of herpes. Let's say a person takes Bacteroidelia for genital herpes, everything goes away in a day or 2, but then labial herpes starts appearing, and they call us asking what's happening, why. That is, their signaling proteins start communicating with each other that something's not right with us. They produce this composition. Generally, the presence of elevated enzyme levels in the body indicate the body is in a stage of so-called attack by foreign protein. And naturally, the first automatic reaction in the body is increased cellular immunity, increased lymphocyte levels, and so on. That is, it essentially acts as an additional indirect immune stimulant. It triggers an immune response, including a general one. Another question, what is RV-ready, which they usually diagnose us with? Because right now, for example, many people are already getting sick. Now there's actually we have our own viral disease monitoring system going on. It's located in several centers in Russia, but the main center is, GRIP is in Novosibirsk. There's a Rospotrebnadzor center. Then through Ministry of Health Institutes, the Virology Institute in Moscow, if they conduct any monitoring activities at all. In order to isolate the pathogen, establish what it is often systematically, you need to conduct such planned research. This is done, but mainly quite rarely. And of course, they monitor those people who come to the clinic. They isolate, let's say, new coronavirus strains from them, various Omicrons and so on. And it turns out that we're now dealing with COVID as some kind of parallel infection that essentially attaches itself to the general category of respiratory viral infections. It doesn't particularly stand out, but the symptoms constantly change. Its severity constantly changes. Some people get very severe headaches, others get severe persistent cough, but that's a separate story. So RDI remains what it was for doctors, so-called general diagnosis, because if a doctor is going to send for viral disease diagnostics, he needs to understand what exactly he's testing for. He doesn't know anymore, so he writes respiratory viral infection. And yet doctors, for some reason, still prescribe antibiotics for obviously viral diseases. On the internet, I found 30 tables for differential diagnosis of bacterial and viral diseases by symptoms. The first obvious sign is clear runny nose, but There's also accordingly eye pain because of the virus. The first thing it encounters in terms of exposed mucous membrane, you have to understand, is our eye. That is, you go into the subway, you go somewhere there, in some store, everywhere people are coughing or just breathing. It catches the eye. Therefore, statistically proven, this was established back in the USSR, people wearing glasses get sick less often. That's all for questions for now. Thank you.